Hi, this is Sarah Mikesell, and today we're here with Dustin Oedekoven. He is the state veterinarian for South Dakota. So thanks for being with us today, Dustin.
Thank you, Sarah. It's good to be here.
Very good. And we're here today at the AASV conference, and I understand you're going to be speaking to the group. Can you tell us a little bit about your talk?
Yes, well, I'm very excited to be here with the Swine Veterinarians, and I was asked by our state lab director, Dr. Jane Hennings, to come to a session on diagnostics and talk to the group about what to do when there's something new. That's the title of it. And it came about as a result of discussions that we had about emerging and re-emerging pathogens, not only in the swine industry, but in other species as well. And in the last several years, we've had, for example, the porcine epidemic diarrhea virus that happened in 2013, or that started in 2013. Here recently, we've been working a lot with swine practitioners, producers, slaughter plants on Seneca virus A, and trying to figure out, how we can improve that process and yet not miss the opportunity to investigate foreign animal diseases.
Right.
So some of the things I'm going to be talking about are how all of those different people can interact together efficiently, the state animal health officials along with the veterinarians, the producers, and importantly the diagnostic labs. And depending on where you're at in your perspective of whatever the new problem is, that starts your path of communication with whomever you choose. The important part that I hope to convey to the group will be that we want to make sure that we complete that communication, because it's important that everybody has a piece of that. In my state, in South Dakota, I'm very fortunate to have a good working relationship with our diagnostic lab, and so I feel like I get pretty good continual updates from the laboratory about the sample submissions that are coming from practitioners. That certainly helps to aid my connections with other state animal health officials, and I think that's and federal animal health officials, and that certainly helps to identify newly emerging syndromes or pathogens, things of that nature. So I also know that the swine veterinarians oftentimes communicate, within their own networks,
Right.
and of course swine producers do, and systems of pig flows communicate within their own pig flows, and sometimes in regions. For example, the PRRS control region. So there's a lot of different groups out there communicating on disease control and
Right.
disease diagnostics, and so I guess part of what I hope to cover is the need to link all of those different communication networks together for the benefit of our swine industry.
Very good. And what's the starting point? So what's that thing where a veterinarian should think, maybe I need to call the state veterinarian like yourself, or to pull in a bigger group? What are those signs or signals?
Right. Well, it all starts with a good relationship between the veterinarian and the producer.
Right.
And we often refer to that as the veterinarian client-patient relationship. And we know that varies a lot depending on the client, but a lot of the clients who are served by the veterinarians here at the conference are very dependent on their veterinarians, and are very tied into their surveillance systems and use diagnostic lab services. So for that group of people, I think they're for the most part aware of some of the clinical signs where we see an increase in mortality or morbidity, a change in the what we would usually think of for, say, a respiratory disease or a GI disease. Something that just doesn't add up, and that's kind of what the diagnosticians are looking at too. Is they run through a list of differentials based on the clinical presentation, but if they're not able to identify that certain pathogen,
Right.
That's where we start doing we start looking for other things, foreign animal diseases, newly emerging diseases, and that sort of thing. So really, anytime's a good time to call the state animal health officials, because we're really just part of that investigation piece. The things that states can often offer are additional personnel in the way of state veterinarian staff, sometimes diagnostic support
Right.
if that's needed, and of course interaction with public health agencies and other state and federal animal health agencies. So really a network of support staff can be offered for those type of things. We do, there are hundreds of foreign animal disease investigations each year. Majority of them turn out to be negative.
Right.
It's good to exercise that system, so we always encourage people, if you're not sure, just call us anyway. We want to help in that process, and certainly none of us want to be the ones who ignore the potential index case of a major foreign animal disease outbreak.
Right. Very good. Well, thank you so much for all the information, Dustin.
Thank you. It's good to be here.
Very good. This is Sarah Mikesell reporting.